from the southeast, so in the Belleville region, and I will be the moderator today. So we would just like to introduce both Heather Napash and Carol Boussois, who will be sharing with us their presentation of My Journey Back Home. And then at 3:45, we will have a Q&A period. So feel free to add your questions into the chat, and then I will read them out and we will go from there. That'll be great. So I think that's everything. I will pass it on to both Heather and Carol to start the presentation. Now I will be sharing the screen and sharing their presentation. So feel free, both of you, to just let me know. Oh, here we go. What slide you'd like to be on. Oh, okay. How did that go? Very good. All right. Start from beginning. How do I do that? Can I do that? Okay.
Press slideshow, Amanda.
I know, where is that? Oh, I just can't see it. Oh, you know what? Is the recording thing is right there. I'm good. I'm good. I'm not really great at the technology. Okay. Did that do it? Or just
And
made
now go from beginning.
Okay. There we go. Okay. There we go. Thank you.
Okay, so is that the very first slide, the introduction slide?
Yes, this is the first slide.
Okay, well, I'll just do a brief introduction.
You want to introduce yourself first, Heather, and then I'll introduce myself, and then we can start the workshop.
Okay. All right. So, welcome everybody. My name is Heather Napash. I am a Talking Together facilitator with Nishnawbe Legal Services. I've actually been doing facilitating mediation ADR for maybe about 14 years now with NAN Legal Services. I am very glad that I'm here today. And I look forward to meeting and, asking any questions and answering anything that you would like to see. So if you do have a question, you can let us know as we're going through. And then if we have time for additional open response questions at the very end, we'll do so. Carol, would you like to introduce yourself?
Sure. Wabshka Migzi Gabishit, Natish Nakaz, Three Fires, Donjba, Achichak Dodum. My name is Carol Buzwa. I am the manager for Talking Together program, Nikiwewan, which is My Journey Back Home, and Mangotawan, which is our new program. And we also have my Nishnawbe Legal Services and CCCN in another project agreement with another facilitator in the North Bay area. So we have a number of facilitators providing these programs in the north and to 49 First Nations of Anishinaabe Nation territory. I have been here since 2009. It has been a very wonderful experience. I've learned a lot. I'm learning all the time. I continue to learn. And I've really thoroughly enjoyed working with the families and watching our families grow and overcome the many obstacles that have plagued our families from a First Nation perspective historically. So we are part of, helping families resolve their own issues, coming up with a plan and moving forward. So, and working with our staff who are put in their, sometimes more than 100% in working with our families to meet the needs of all ages of our families. And working with the organizations as well and partnering. with the agencies. So that being said, Heather, My Journey Back Home, Nikiwe Win is one of our programs that came to us in 2021, I would say 2021, and it was an opportunity to submit a proposal. So we did, and it is a form of, again, mediation and ADR, sorry, ADR, Indigenous ADR, working with clients that are struggling on the streets, human trafficking, couch surfing, addictions, you name it. And this actually came after the height of the pandemic. So we were very busy. So that being said, I'll let Heather carry on.
All right, thank you. So we can move to the next slide. So with my journey back home, supporting people beyond treatment, I'm just going to read it out quickly, and then from there, I'll give you an example that we have shared with some of our clients, families, youth that we work with. So substance use is a complex reality in Thunder Bay affecting individuals and families across the community. My journey back home, Nikki Lewin, supports people not only during treatment, but after or throughout the entire journey of recovery. This presentation explores the challenges that people face, the barriers they encounter, and how my journey back home aftercare worker. So that our aftercare worker, who's not here today, but her name is Christy Martin. She does a lot of one-on-one work with our youth, our families that we're working with. She actually helps them during the process in their treatment there. And then we have our facilitator that will do the circles while in treatment or post-treatment. With the support and help with them, they navigate towards stability, healing, and hope. So by saying that, when we do meet with our youth, and we're probably going to explain more throughout the presentation itself, but our aftercare worker, she would meet with the youth one-on-one, complete the referral, have the referral approved by our manager, Carol Buswa. And then after that, she would make one-on-one visits with them, figuring out what the needs, what their strengths are, where their weakness lies, and figure out what they want to do to move forward, to be in their process of their healing journey. So when we're working with them, they have a variety of different issues and concerns that they have, and we try to work on one-on-one with them in their in in the best way we can, so we're not overwhelming them. And by doing that, some of the things that we've looked in the past is when they want to go to treatment, they need somebody to work with them one-on-one first, figuring out what treatment best suits their needs, where they are, and then from there, where are they going to go? Which treatment best fits their individual needs? And then, so Christy herself, the aftercare worker, would meet with the client and even gathering additional support people, and we'll identify that in our circle process. So we try to get them to where they want to go. They identify what they want to speak to, address, and then Chrissy would then later on make that initial circle for us to come together in a circle to figure out and how to support our youth that we're talking with. You could change it to the next slide and then we'll go in a little further. So as Carol had mentioned, that my journey back home is community-based healing initiative supporting youth and our young adults affected by human trafficking, homelessness, and their addictions and health. This is rooted in Indigenous values and restorative practices. The program helps community members rebuild their lives by creating individualized healing plans. So each plan that we create with our youth, it's unique in their own way, because we know that each youth that we work with, they are different. They have their own special qualities that they bring forth to the table when we're working with them. And they have their own weaknesses and barriers that we need to help support them and advocate them along their journey. And that's what we have our aftercare worker there to help them with that. And she will help them identify other places that, or people, networking and working within the city of Thunder Bay to help them, support them, guide them, and creating those healthy boundaries. The services and supports, the purpose is to empower the individuals to take ownerships of their own healing journey and find a better path. So by allowing them to come into this circle, they're able to identify what their needs are, how they feel that they be able to, um, not a challenge, but how they feel like they can overcome those barriers. And having the support people or the agencies and these people come to the circle, they can work with them to advocate along the way. Next slide, please. So in our program, the support program itself, we do have our aftercare worker, as mentioned. She plays, he or she, in this case, it would be a she. So they play a key role in helping community members navigate the complex systems. And this is not limited, but some of these things that are addressed. So coordinating access to addiction treatment programs, trauma-informed counseling, the safe housing, supporting clients with applications for treatment and counseling, securing funding for that to happen. And then also ensuring no one faces barriers alone with their path of recovery and independence. So I just want to clarify that. So when we do meet with the client, the youth that we're working with, Christy does ask them about what type of addiction that they are facing, whether it be alcohol, um, opiates, or depending on where they're from, it could be something a less, I don't want to say less or more, but it depends on where they are in their healing journey and if they are working to cut themselves down so that they're able to go to treatment, or if they're on Suboxone or methadone. So these are some of the things that Chrissy would go through the intake with them. So when they are looking for that, sometimes they are homeless and they don't have an actual home address. So when we do receive a phone call, Christy tries to go to them right away, because when we have our people that are struggling, they kind of want the help now rather than later. And if we don't have a contact information, whether it be a phone number or an actual mailing address for them to, our workers to go see them, we have to meet them at their level and go to where they are. Um, so whether she meets them at a local coffee shop, somewhere where she may take them out for a quick lunch to eat, just so that she's able to talk with them in a freely open space, that she can fill out the referral form, get the consent form signed, and work with the people that they're already involved with. And if they're not involved with other agencies, then she asks them, well, where do you feel comfortable with going to receiving treatment or counseling, things like that, that helps that individual become a better person. Um, so when we are looking for treatment, there is a lot of financial restraints contributed into sending someone to treatment, whether they need to get the travel to get to and from, or just paying for the treatment itself. Going into a local facility, such as Thunder Bay, or even outside of Thunder Bay. Some of our people that we've worked with, they go down to Aurora, or Gimli. Those are some of them. And I think in the past, we went to one in Vancouver.
We
So
also had maybe you can mention the one that had the different sponsorship, because he didn't fit the criteria of the regular route for funding to participate in a treatment center. They applied through a sponsorship through the treatment center, which was $20,000, and was received that to be able to attend the treatment. So Christy was very was
persuasive.
yeah, she definitely was very worked with those agencies and those those First Nations and the treatment center. There's a strong relationship there now that we have that communication with them.
Mhm.
So that was a really a big success for that particular individual.
So, by trying to secure funding, how would I say, like with my journey back home, we don't have the necessary funds to send someone to treatment where we can't pay for their treatment. So we have to outsource other agencies or First Nations to try help them help their people to get to treatment. From what I've understand in the past and working alongside with Christy is that she has reached out to a variety of different First Nations because it is open to Thunder Bay. The youth that I'm talking about, they are between the ages 12 to 29 and they do reside in Thunder Bay. So when they're in the community of Thunder Bay in the city, we try to contact their First Nation, ask them if they have the ability to sponsor one of their community members to go to treatment. And it has been before Christy had made many phone calls with band reps or chief and council, the health director, or someone who holds that portfolio and who's working with the youth and addictions and where they're going to. So by that, she's made contact with them. She's managed to send some of the community members to their choice of treatment facility. The one that Carol was talking about, I believe, is the one in Aurora, Gimli on Manitoba, where before it was kind of like we'd send maybe two or three people. And I think in the past we've sent a handful more youth to go there and where they stay for the 6 to 8 weeks. Then it was extended to aftercare, and then the outside living on their own, but still in the community of the Gimli area, so they're still in the treatment. So it opened up the doors for them for almost over a year now. And some of the youth that we had in the circle for the aftercare, for my journey back home, they went for treatment. They stayed there. They are still dealing with their recovery, and they've been sober, living a sobriety for at least a year or a couple of months that they've stayed there. And then also they were able to have a job at the Aurora Recovery Center in Gimli, Manitoba. So we do see some success in that when we're looking at the roles of our workers and what they're able to do. But it also stems from the importance of our youth and how they want to live in their sobriety and how they want to access services and what they feel is next for them to continue working on themselves. So as I said, we have our facilitator, similar to my position with the Talking Together program. They would continue to facilitate the circle, working with the youth, having those support workers involved in the circle, and then we invite the other people too, as well as the people that are attending the treatment facility, the AA sponsorship. They can come involved in the circle. We have our elder, and then we identify what is their next stage, and if they return to Thunder Bay, or maybe not even Thunder Bay, but where are they going to return to after they completed treatment. So they're trying to figure out what is their after the treatment, what they're going to do, their goals, and then how can they obtain that, and then trying to lower that risk or the ease of our youth that we need to help. And then the cultural supports, we do have our elder involved in the circle, or a traditional person who the client themselves, the youth that they feel safe to be involved in the circle. And then we help guide and participating. So it says reclaiming identity and purpose. Next slide, please. And sorry, I'm looking on my phone and it's a very small screen. So the reality of substance use in Thunder Bay. Substance use touches all parts of Thunder Bay community, with many individuals struggling with in isolation. Indigenous and marginalized populations are particularly affected due to systematic inequalities of historical trauma. Understanding the reality of the route, understanding this reality is essential to creating supports and meet people where they are, providing more than just the treatment itself, supporting their addresses, the whole person, their environment, and their long-term well-being. So when we're looking at their treatment, we try to focus on the one thing, but also incorporating um, their physical health, their well-being, their physical. Like we try taking on the four essential parts of us to make us a better person. We also look at the people who are surrounding that person. Do they feel safe and comfortable in returning back to their prior, where they were living before, who they're staying with? And if not, then we try to figure out a safe housing for them to return to. So we also, we have 3Cs in Thunder Bay. We have the Seaway program. These are some of the things that the youth can apply for, but there is a wait list for that. So we try, if they want to return back in the community, then we have to start making that application happen before they return so they have a safe space to come home to. Next slide, please. The stigma and barriers our clients are facing. We all know that our youth are in a certain situation, but also when they have limited access to services. We have our aftercare worker who is there one-on-one to support them during these times of trouble. So many of them, they face long wait times, transportation barriers, the funding and limited treatment options, and that's in Thunder Bay and surrounding communities. Because our area is focusing on Thunder Bay. The stigma and fear of judgment, the shame and the fear of being judged, it does stop many people from reaching out from help and with their addictions and trauma and their exploitation. By following through some of the cracks that we have, the community members often lose support when transitioning between their health care, the justice itself, housing and treatment systems. The intergenerational trauma and disconnection. So historical trauma has lost many of their cultural identity, the impact of what they're facing, the healing, and the ability to rebuild stability. So when we're working with our youth, we try to promote a healthy lifestyle with them by how they see fit, introducing them to a stronger community, identifying service providers who can help with them, maybe even getting them a normal into a routine to receive their health care. And then also when we bring them to their appointments, we try to help them through that, gradually ease them into, you know, receiving the services that they're able to, which anyone should be able to access, right? But for our youth that are struggling in their addictions and the fear of being judged, they may not want to go for help if they don't have that support person with them at the time. So our aftercare worker would be there, advocating with them side by side, walking along their journey with them, helping and being there for them when they need that opportunity or the services available for them. Next slide, please. So how my journey back home overcomes these barriers. Um, for one thing, I do believe that they do bridge the gaps of that, working with our youth that are involved in the process of that. And if they fall through the cracks, then who's there going to pick them up? How are they going to be able to provide services if they're not able to meet them at their needs, their level? We're not there to judge them as well. So we're there to meet with them, creating a safe space, being able to meet with them when they need it. And that's having our aftercare worker is available not just from the 9 to 5 area. I believe that she does work a bit more in the evening because we know that our youth sometimes sleep during the day longer hours than normal people, or what I would like to sleep in. If I could, I
Not
would.
they'd be non-traditional hours, we'll call it.
Yeah, because
Yeah.
I think I would like to sleep in during the day and work all night, but I can't.
Yeah,
But
same.
knowing, yeah. But we do have Christy who's there answering phone calls at like 10 p.m. or even on a Saturday afternoon or morning,
Mm.
because sometimes we know that our youth are different people and they have different hours. So when she gets a phone call, she does meet with them. She introduces herself. She will figure out what their needs are, meeting them, providing, a safe space for that. So that's what we said in there before in the very beginning is that she either meets them at a local coffee shop or brings them somewhere to get some food, because sometimes we don't know if they ate that morning or if they've been sleeping all day and they are groggy and they need a big hot cup of coffee. But when they're working with them, they are going through the healing of their culture, um, healing through culture, and that's why we invite our elders to be in part of it, because they have a lot of knowledge and they support cultural inspirational quotes that they have in the past they've worked on, and they know some things that maybe our youth have forgotten about it because of the loss of identity or not being able to return home to experience that cultural wave that we long for in ourselves. By having that elder being there supporting them and working and being able to just be there for them in that circle time that they need. Resistance and during transition, medicate. Okay. All right. Next slide, please. Next slide. Okay. So when the treatment is over, many clients complain. So um, part of and that's not, how should I say this? Okay, so our aftercare can work with them where they are. So she can meet them at the detox center. She can meet them with the agency being involved, or if they're going to a healthcare provider, she will meet them where they are. From there, she works with them, and then if they do complete treatment, or they left without completing it itself, our aftercare worker would be there to work with them. So they do identify ongoing supports. Without the guidance, the risks of relapse, homelessness, or disengagement from the services are high. The lack of housing, mental health resources, and community connection creates gaps and often becomes a crisis. And then so we have the aftercare, the aftercare worker, the program itself, and the facility. They start identifying the steps in this crucial point, providing continuous aftercare to ensure that clients do not return to dangerous patterns once treatment is completed.
Mhm.
So when they go to treatment, once they complete, Kirsty will have Kirsty, the aftercare worker and facilitator. They will meet with the support people, figure out what the plan of care is when that youth is out of treatment, where that youth is going to go, how are they going to return back home. So when they transition out of care, out of treatment, that they have a means to get home and where they're going to be staying at that time. And that's when I brought up the 3 C's or the C way. So those are after recovery steps that we have. Um,
Mhm.
but they do need to fill an application form for that. And when they're in treatment, they know they're returning home, that we'll have that application in the works already. So then that way, if they do return home, that hopefully by then they have a spot or a bed to return to, and then they work on a plan. So when they do return, or if they're in Sealy or in 3 C's, they have to do either they return to school, they have daily chores, they still have to remain in their recovery. They do work with, they have men's groups, healing groups, or they outside resources as to go to cultural nights, drum nights, or shaking tents, or attending uh, cultural events in the city of Thunder Bay here. And those are all acknowledged during the circle processes and figuring out what that youth would need in order to return home and how they would feel safe. Next slide. Why aftercare and wraparound support change outcomes. So I'm going to read this quickly, and then after I'm going to share an experience from that. The aftercare and wraparound support connect multiple aspects of a client's life, including mental health, housing, justice involvement, culture, and community. By addressing these areas together, support, advocacy, and culture grounded care help clients navigate challenges, build resilience, and remain engaged in their recovery journey. Wraparound care ensures no one falls through the cracks. So, what we want to do is making sure that our youth are able to identify what their needs are prior for them to leaving treatment. And when they get out of treatment, they have a long list of support people that they can call upon. Um, so when they leave, they know where they're going to go. They have a lined up maybe appointments for their healthcare or dental plans, whatever that they need getting out of treatment, or sometimes this is something that they've been doing or working on while in treatment, and somewhere where they can continue to receive those services once they are out of treatment. They also help with their housing applications, figuring out where they're going to be living when they are out of treatment. If they are involved in court, because some of our youth are involved in court due to their addictions, they become criminally charged. And then they work with their probation officers to let them know that the youth had for treatment and they should be completed the treatment day on this day, and they'll be returning and living at this home. So our aftercare worker does a lot of that, working with service providers and creating that safety net that they need to support them while they're out on living in their sobriety. The challenges building resilience and maintaining their recovery. Does anyone have any questions, or we're going to save it for the very end? Because I can't see anything. All right, so we'll go to the next slide. Okay, so this is what we call in our circles. So our healing circles and cultural grounding. So in our circles, allows participants, the family members, our youth that we're working with, as key support people, the workers, to come together in a safe, non-judgmental space. And together they will identify the goals of recovery and stability, develop a personalized care plan. And that, like I said, our youth are very unique. So one may work one way, but not for our other youth because of their individual needs. Strengthening their support networks and ensuring ongoing accountability. So when we are involved in the circle, if someone has agreed to drive that youth through the treatment, then we're holding that person accountable to get that person there. Um, we just want to make sure that we know what we're doing. We're lining up our ducks. We're making everything work and what we have to offer. And then we hold, everyone will receive a report of that circle, um, just so that they know what they agreed. They have a physical copy in their hands, and this is what they're willing to work with. So in our circle participants, I may have not said it, but I will say it again. We have our facilitator, the aftercare worker, the elder, and our youth, especially our youth, is present. And then we ask the youth, who do they want in their circle? Who's going to be there to advocate with them along their way? How can we introduce them to come along in the circle so they know that they're not alone? They have people in their corner that are willing to help them in any way by needs. Oh, gee, sorry. Just dropped my phone. I'm working on my phone and things just keep sliding down. So in the circle process, it empowers our participants to have a voice of their own healing journey. When they know they have their voice to say something that they need or they want, they have we are giving them the opportunity to strengthen themselves. By then they will carry out the plan, um, and they work more harder because they know this is what they want. And we have the people there to support them along the way. Next slide, please. Okay, so this is our stuff that we have talked a little bit in the very beginning when Carol did our introduction for my journey back home. So this program was launched and has supported since then roughly about 200 people or more. Then the 3/4 of those having, what does it say? The 3/4 of those having identified substance care uses. Approximately 75% of these access some type of treatment, and 55 maintain post-treatment engagement with the aftercare services, whether it be for a few weeks, a few months, or still ongoing. The data reflects both successes and ongoing challenges, supporting the crucial role of consistent support in helping clients remain on their recovery journey, and the difference wraparound care makes in real lives. The goal, or everyone's goal, is to make seeking help a smoother journey by ensuring our community members in Thunder Bay have the access to the care, compassion, and connection that they need to succeed. When we're working with our youth, we understand that they are vulnerable people. Sometimes we have shy ones, sometimes we have very vocal youth that know what they want, and they're not, how they express it is up to them. Sometimes we like to have a visual board, so then that way they understand that this is the timeline that we're working with. And we may have 1 month, 1 week, or even a longer opportunity to work with them. And by them, we need them to be involved in us as much as possible. And then we give the opportunity. They do have the check-ins once a week with Christy, our aftercare worker. For them, they work with her one-on-one. They let her know that, since I completed treatment, I've returned back to school. I've done guest speaking too. We had one of our youth, he participated in one of our presentations in our luncheon, and he was able to share his experience with my journey back home and how he started, where he ended up, and what he continues to motivate himself to move forward with. We see that as a very successful story for him. And within himself, he was able to share that experience with us. And that it allows us have the opportunity to walk along with them and sharing their journey. Next slide, please. So the ending on our hope is that healing from substance use is possible when our people have access to holistic, consistent support. My journey back home reframes substance use as a health and systematic issue, not for not for moral failing, but through advocacy, aftercare, and cultural grounded support. Clients can rebuild their lives, enjoy um, even for their journey is unique, but with my journey back home, the path towards safety, stability, and hope is clear and achievable. So when we are working with our youth, we provide that ongoing advocacy. They have the worker there to work with them along the way. And when we work with them, it may be that first couple of days that we try to bring out those information that they need. And when they are ready, they they may wander a little bit, but most of them do come back and they require more assistance. And when they're ready, that's when we try to jump through those hoops with them and figure out what their needs are to having that ability to work with them and living their best life. Next slide, please. So in our last slide here is just our contact information for my journey back home. Carol is our manager. Her contact number is there. We have our program lead assistant, program lead. Her name is Zelda Watt, our aftercare worker, and our facilitators numbers, contact information is there. And then so we do work in Thunder Bay. So that's our office on the Syndicate Avenue office. In Thunder Bay, this program, it is only available for youth living in Thunder Bay. We've been doing some presentations to other organizations and service providers, and even when we go into Nan First Nation communities, we promote our Talking Together program. We also share Mango Talon and we share My Journey Back Home. And they do see the differences in our the programs itself, and then they want to know how can we have My Journey Back Home involved with our youth. And that's the tricky part, is because we're unable to provide those services that are not, if they're not in Thunder Bay. So we're trying to promote the Mango Talon with them as well. If we need to figure out what program services or the programs that we have involved with non-legal, how it fits our youth that we're working with in the best way. So catering to their needs to promote what they need and how to access those services. We're hoping that by developing these programs that it fits them well. And if not, we try to outsource and help them identify their needs and goals, and we'll help them go to where they need to go for that if we're unable to provide those services to them. Do you have any questions? I believe that is our last slide.
Okay, thank you both so much for sharing. I'm going to go to the chat to see what I have in here. Okay. Oh, no questions yet, but I do have a question, and it was I'm just thinking about the kind of connection with your youth involved in child welfare. Do you see like a lot of youth involved in child welfare? And what does that look like to with your like within Thunder Bay or Child Wellbeing Agency? And sort of what does that look like in like the circles and that sort of thing? Like, are they involved or is it separate? I'm just wondering about that.
Number we have Tikanagan here, and we
Okay.
have Delico, and there is a number of youth that are involved in child welfare. So we do have a protocol with Delico. But I find there's some challenges around that, and it's I'm not sure. um you know, because we really haven't gotten a lot of referrals from them, and
Okay.
I'm, curious as to why not, because really we should. But I'm not sure if it's an agency in-house thing, or I really don't know, but I know that I'm not the only one that's in the same boat.
I just have a comment, not a question, but I just want to say I've been around a long time, Carol, and we've been involved in you, and it's nice to see this program up and running. And I know it'll do a lot of help and support for the teens in your communities. So I just wanted to say great job.
Thank you.
Thank you.
That's great. Is there anyone else that has any questions or reflections or comments they wanted to share? Comment here, from Sandra. Thank you for such a heartfelt presentation. I appreciate the awesome work you do with the youth.
Thank you.
Yeah, just a quick comment. I think that's so important. The development of those natural supports around the youth. I think that's really important for success. And with the changes, to child welfare in regards to those, building natural supports, I think that really resonated with me about how important that is to have the community around the individuals. And as well, Heather, you talking about the individuality and that intersection of each person and how each journey is going to be different. But I do appreciate that, you come together in that circle with the people who the youth want to be there, and then being able to build on that. And I think that's very important because we know, human beings are driven by connection. And I think that was really important to me, and that really that resonated with me in regards to the importance to ensure that in my role, because I'm a youth support worker, so I am working with youth, of building those connections around them.
Thank you for that.
Mm-hmm.
I just want to say Hi, Carol. I did speak to you before. I'm the ADR coordinator for Thunder Bay Counseling. So I just wanted to say hey, and I really enjoyed the presentation, and I have that information locked and loaded. Thank you so much.
Oh, awesome. Great.
If there's any other questions or thoughts, I should have more questions. Um, I can't think of anything else. Anyone else think of anything that they're burning question?
Actually, I was just curious about funding. How about does your organization get funding and where is that coming from?
Right now our funding is coming from MCCSS. It wasn't originally. I believe it was coming from DOJ, I believe, and then it went to MCCSS. And to be honest, this was started in 2021. I was just actually writing this down. Yeah, Christy got hired in March 2022, and we had funding for 2 years, and then we had no funding, so we had to close up shop in 2023, and didn't have the program for about 8 months. And then in the fall winter of 2023, all of a sudden we got a call, we got a letter, can you reestablish my journey back home? Nikki Wayland, can you reestablish it? 8 months later, I'm like, well, we just lost our workers. She's been doing this for the last 2 years, and now you want us to reestablish that? I'm like, ah. So what ended up happening was she came back because she herself comes from a former detox organization that she worked for, and she worked there for many years. And what her what she felt was a problem in detox is after they're done detox, they just go and they're on their own and we'll see you later kind of thing. There was no aftercare for them. There was no supports or any wraparound services for them once they left detox. And then when this program came to being and she saw it and she said, that's exactly what our clients need. They need this and they need it like now. So she jumped ship for originally, and then even though we had no funding for 8 months, she came back, which was a real really, we are very grateful for that, because that is a rarity, and we were grateful that she came back. And then so we've been running since fall and winter 2023, and I believe we are funded till 2027. So, I mean, I think we're on the right track. And, continuing to provide, the best possible service in the best interest of these young adults, young children, teenagers, and adults in a good way. It's not without its challenges, mind you, but you know, uh, it's been a journey, I would say, for sure. And it's been a very, very good one in that we see here in Thunder Bay, we see a lot of death, we see a lot of overdoses, we see a lot of and we hear lots, and we have families that know other families that have other people or family members that have passed on, and our communities as well. So, we're just a small speck of help and hope, I would say, and just trying to, reach as many as we can, in the best interest of their healing and them being empowered to find their own answers and goals to get to a better place on this journey. I don't know if that answered your question about funding, but
No, but it was very like, yeah, it just also reminds me of how important again that wraparound approach is for our, children and youth in child welfare, right? So it does connect, and I think that's important. And no, you did, and I appreciate your answer.
Thank you.
Does anyone else have any other thoughts or reflections or anything they wanted to share until so I guess we need to going back into the main Zoom room. It looks like for closing remarks and evaluations around 4, so we still have a little bit of time. Anyone has anything else?
I just want to say, I thought it was really good when you said earlier too, like about breaking down some of those barriers by even providing them with a meal. Like
Yes.
it's so simple, but it makes such a huge difference in their day. And like even when they talked about it, it's like I can think about myself if I'm hungry, I'm at work, right? But it's even, when you're dealing with someone that has so many barriers against them. And I think that that's a really good way to start to develop a relationship as well too, because I think that a lot of the clients that we work with, they don't have a phone. They've broken down with the communications. I know I worked at Ontario Aboriginal Housing as well too before, and the hardest people to house were the homeless. And it was because they didn't have a phone. They had no way of communication. And so what I would do sometimes is get them connected with a social service agency, perhaps, in Red Lake, where they would go. I'd say, like, where do you go to get coffee every day? Or go get something more, And because that was the only means of actually reaching out to them to even be able to, offer them a home if when one become available. So it's nice to see that your program recognizes that those are barriers for clients and helping to break down those barriers, like even simple things like a phone card, right? Or a grocery card, because the obstacles that they have every day can be so overwhelming. And like what Nancy McDonald had said earlier, it's like really about kindness, right? And just taking that time. So miigwech for your work.
Well, thank you. You're welcome. And a lot of respect
Mhm.
for sure. You good.
Thank you.
Hey, I guess we're done early. That's okay. We'll just, so you can go on the link or even do, oh, it looks like Tammy put in the survey if you wanted to do the survey and then just join back, I guess, with your personal link again to the main Zoom room when it's around 4 o'clock or anytime. I mean, you can join back in now too. But thank you both so much for your time and your presentation, and it was very, very interesting. So thank you for that. That was great.
Thank you.
Thank you.
Great. Take care.
Right.